As Americans continue to face new and difficult challenges, Hiring America is speaking with experts and organizations around the country to help support our veterans and their families during this trying time. This week, we're speaking with Dr. Deborah Birx, U.S. Army veteran and coronavirus response coordinator for the White House Coronavirus Task Force. Dr. Birx, thank you for joining us here on Hiring America.
Happy to join you, and really thank you to all your listeners for supporting the military and for all of our active duty. Thank you. And for those of you retired, thank you for your service. I'm a proud member, 29 years active duty Army.
Many people know that you're currently part of the White House Coronavirus Task Force, but many people may not know that you served in the Army for over 25 years. Please tell us about your service.
I was very fortunate. I came into the military February 1980 and was able to serve at Walter Reed, first in internal medicine and then clinical immunology and then basic immunology, which is shared fellowship with NIH, where I met Dr. Fauci. And so we have been joined together for 38 years studying infectious diseases and immunology, and the military really supported me to both do basic science and bench to bedside science to really serve the soldier, both the active duty soldier and the retiree, and really being able to work across the agencies and across the services. Sometimes people say to me, wasn't it difficult working across agencies? And I'm like, well, you don't understand the active duty services if you don't think that's difficult at times. So that early work of learning how to bridge and work across each of our services for the success of all of our military members was really a critical learning in my early career.
How was your experience and training as an officer in the Army help prepare you for taking on what I imagine has been your biggest professional challenge and arguably the biggest challenge the world has faced in recent times with COVID-19?
It's very interesting at the time, because when you're a young physician, you think all you really need to know is medicine. And yet they made you take advanced training. They made you take the Command and General Staff School. And at the time when I was learning federal acquisition law and procurement and budgeting and leadership skills, I just really couldn't understand how that was helping me lead as a physician dealing one-on-one with patients. But if I hadn't had that critical military leadership training, the training around teamwork, the training around using data for decision making, the understanding that the mission can't be completed unless every team member understands the mission and understands their role in the mission, that has really been a critical foundational element for me in this job.
What advice would you give to transitioning veterans about to enter the civilian workforce? How is their military experience an asset as they forge new career paths?
I think there's two critical elements of that. One, duty first. And so every military member knows that they're there to serve others. And I think any employer would and should want to have a veteran that understands duty first. And secondly, understanding that for the mission to succeed, all of us are working together and no job is too small. And I think that's really been also a critical point of my training. If I need to Xerox something, I Xerox it. I mean, we are a part of a team, and no job is too small for any individual. And I think that's what the military trains, team and duty.
The administration has faced a lot of criticism for its response to the pandemic. In hindsight, is there anything we should have done differently?
I think early on, I think many people, including many of our leaderships in the agencies, really thought that asymptomatic spread was a small component. Early on, about 17%. We could tell by looking at the curves in March that you don't end up with this kind of explosive hospitalization unless there's significant community silent spread. And I think we knew then how important testing would be, and it did. And we started working on testing the end of February, beginning of March, and all of those nucleic acid platforms came to be across multiple platforms because of our focus on translating science to the bench and really making science to the bedside and really making testing available. And I know it took 7 months to get these point of care antigen tests, but that's when we started working on it. And I know sometimes it's frustrating to the American people to not see all of the basic science that has to go into this development of a really accurate, highly sensitive and specific test. And what I know that's taken 7 months to get this, but being able to have 50 million antigen tests available every day, every month will be really critical for this fall. And so, yes, I'm very impatient. I always like things to go faster. I would like testing development to go on faster. I always wish that therapeutics would go faster, but they have to go through clinical trials for safety and efficacy. And I always want the vaccines to go faster because that's how we get to true herd immunity. But the American people deserve a accurate test, a quality test. They deserve quality therapeutics, and they deserve a quality, safe, and effective vaccine. And so these things do take time, but I can assure you we're going as fast as we can in partnership with communities and the pharmaceutical companies. And let me just thank, I know there's probably military members who have volunteered. Let me just thank every military member and their spouse and those associated with the military for volunteering for these trials. Because nearly between all of the trials, probably close to 75 to 100,000 people have been volunteering. This is really critical, and they're providing the foundational information on whether these vaccines are safe and efficacious.
I know it's impossible to predict, but can you share with us what the best case and worst case scenarios are as we head towards 2021?
I think the best case scenario right now is every American heeding our voice, because we know now from our evidence across the South that if we wear masks, if we physically distance but stay socially engaged, and if we avoid crowds and ensure that we have our mask on and any time we're in a crowded area, so not creating neighborhood parties or family parties where we've seen most of the infection occur across the summer. Our best outcome is if we pull together as Americans and do these critical common sense pieces through the fall as our bridge. Yes, we've improved therapeutics, and yes, we can treat you even better in case fatality rates have gone down. But let's not even have the case. Let's work together to stop this community spread. We know it's in the heartland right now. We know it's in the upper Northwest, from Montana all the way across North and South Dakota into Minnesota and into Wisconsin and now Illinois, as well as the heartland. Together we can change that. That is our best case scenario. That's what I believe can happen, and that will be our bridge to the time when we have a vaccine to stop this pandemic for all at once.
Dr. Birx, thanks for joining us on Hiring America.
Thank you.